Is a collapsed disc stealing your ability to stand? Your spine moves thousands of times a day, bending, sitting, lifting. But that movement depends on tiny cushions between the bones. When one cushion breaks down, pain can stick around. With degeneration, the disc loses height, strength, and flexibility. This leads to instability, meaning abnormal movement between bones. Abnormal motion can irritate nearby nerves and pain receptors. When pain matches disc damage, fusion may be recommended. Anterior Lumbar Interbody Fusion approaches the spine from the front. This route gives direct access to the damaged disc. Importantly, it avoids cutting through major back muscles. The damaged disc is removed to eliminate painful motion. End plates are bone surfaces where the disc normally sits. They are prepared carefully to support bone healing. A spacer replaces the disc and restores normal spacing. Restoring disc height also improves spinal alignment. Some patients need only the spacer for stability. Others benefit from added screws placed from the back. Major blood vessels lie in front of the lower spine. Careful planning helps reduce approach-related risks. Walking is encouraged soon to support recovery. Fusion develops gradually as bone grows across the spacer. The long-term goal is stability, alignment, and reduced pain.